All right, now the world was slowly beginning to learn and deal with the virus. But what is happening right now is pretty shocking, especially in Europe. COVID-19 cases are surging, and once again it is Europe that has emerged as the epicenter of the pandemic. France has reported more than 50,000 cases of infections in just the last 24 hours. The spike has come despite a successful vaccination drive, where millions and millions of people in France have even received their third booster shot of the vaccine. Now remember, France had been recording a daily average of almost about 41,000 new cases of infections over the course of the last week, in comparison to the 28,000 cases that it was recording as a weekly average just about a week ago. And according to reports that are coming in, 694 people have been admitted into hospitals in France in just the last 24 hours due to the COVID-19 infection, and at least 119 of them are said to be critically ill. France's recent surge has come as the country is now stepping into winter, and this spike, as expected, has overwhelmed the very fragile healthcare system in the country. Doctors across France have again taken to the streets. They're demanding for an end to the bed closures and for better work conditions for frontline workers.
Ce qu'il nous faudrait, c'est un moratoire complet sur la fermeture des lits. Il faut une vraie négociation sur les salaires pour que l'hôpital redevienne attractif pour les acteurs et une politique sociale qui permette aux gens de pouvoir venir travailler à l'hôpital avec des salaires bas qui soient attractives, alors qu'aujourd'hui les gens fuient les établissements publics parce que les conditions de travail se dégradent du fait du manque de personnel.
Pilote l'hôpital, et puis surtout on a aujourd'hui besoin de faire revenir des personnels soignants dans l'hôpital, et pour nous ça veut dire aller jusqu'à 100 000 infirmières, infirmiers supplémentaires. Vous savez que dans la plupart des pays, on a une infirmière, un infirmier pour 6 malades. Dans notre pays aujourd'hui, c'est pour 12, 14 malades. Ça veut dire des semaines de 50, 80, parfois 100 heures. C'est absolument irresponsable. On met en danger évidemment les patients, les malades. On met en danger les personnels et vous voyez qu'ils fuient. Il faut changer le système.
Now, despite France being a developed Western nation, the fact of the matter is the French healthcare system is yet again on the brink of collapse. There is an acute shortage of staff. Local reports indicate that as many as about 20% or more of hospital posts in France remain empty. The staff has either left, it has resigned, or it has gone on sick leave, or has been suspended for not having taken the COVID-19 vaccine. Remember, the healthcare professionals across France are required by law to be fully vaccinated, or they face suspension. The crisis is now ringing alarm bells yet again. However, the French authorities are pretty hesitant to enforce tough restrictions. The French Health Minister Olivier Véran has for the moment ruled out the possibility of a lockdown. He's rather urged all adults in the country of 67 million people to sign up for a third COVID-19 booster vaccine by the middle of January. After the 15th of January, all eligible adults will have to show proof of having taken a booster shot no more than 7 months after the second dose to maintain a valid COVID pass. Only then will they be allowed to enter into restaurants, bars, gyms and other public venues. France has so far reported nearly about 7 million cases of COVID-19 infections. More than 119,000 French people have also lost their lives to the deadly virus so far. WION is now available in your country. Download the app now and get all the news on the move.